A resuscitation mask is a transparent, flexible device that can be sealed to the face, covering the person's nose and mouth. It has a one-way valve that allows you to give ventilations without making mouth-to-mouth contact or inhaling air exiting from the person's lungs. The resuscitation mask may also have an oxygen inlet that can be attached to a supplemental oxygen source. Resuscitation masks come in various styles. In aquatic settings, round resuscitation masks like this one are common. These masks are easy to place and use in and around water or on land. This style of mask is one size fits all for adults and children older than 18 months. Always follow the manufacturer's recommendations for use. When you are using this style of mask, place it so that the round opening is over the person's mouth, like this. Other resuscitation masks, like this one, are more pear-shaped. This style of resuscitation mask is sized specifically for adults, children, and infants. You must use a mask that is sized appropriately for the person to ensure a proper fit and tight seal. When you are using this style of mask, place the mask at the bridge of the person's nose and then lower it over the nose and mouth, making sure it doesn't go past the chin, like this. There are 3 different techniques you can use to seal the mask and open the airway: the head tilt chin lift maneuver, the jaw thrust maneuver with head extension, or a modified jaw thrust maneuver. The technique that you use depends on your position relative to the person and whether the person has a suspected head, neck, or spinal injury. When you are positioned at the person's side, use the head tilt chin lift maneuver. First, place the mask so it covers the person's mouth and nose. With one hand, place the space between your thumb and index finger at the top of the mask above the valve. Rest your remaining fingers on the side of the person's face. Then, place the thumb of your other hand along the base of the mask and place your bent finger under the person's chin. Lift the person's face into the mask and open the airway by tilting the head back. Gently but firmly hold the resuscitation mask in place to form and maintain a good seal so air does not leak out of the sides when you give ventilations. Remember, the degree to which you tilt the head back depends on the age of the person. Tilt the head to a past neutral position for an adult, a slightly past neutral position for a child, and a neutral position for an infant. When you are positioned above the person's head, use the jaw thrust maneuver with head extension to give ventilations. Place both hands around the mask, forming a C with your thumb and index finger around the sides of the mask, and an E with the last 3 fingers of each hand under the person's jaw. Alternatively, when you are using a round mask like this one, you can place your thumbs along the sides of the valve and your fingers under the person's jaw like this. Simultaneously, seal the mask and open the airway by lifting the person's jaw up into the mask and tilting the head back. If you suspect a head, neck, or spinal injury, use a modified jaw thrust maneuver to seal the mask and open the airway. Use the same hand placement as for the jaw thrust maneuver with head extension, but lift the jaw up without tilting the head back. Once the resuscitation mask is properly placed and sealed over the person's mouth and nose, and the airway is open, you are ready to give ventilations. To give a ventilation, take a normal breath. Make a complete seal over the mask valve with your mouth and blow into the valve. When you give a ventilation, maintain an open airway and be careful not to push the head down. Before giving another ventilation, remove your mouth from the valve and take another breath. This allows the person's chest to fall. Watch as I demonstrate. Here's what giving a ventilation looks like if you are positioned above the person's head. Each ventilation should last about 1 second and make the person's chest begin to rise. Be careful not to provide ventilations too fast or with too much volume. When you see the chest begin to rise, you know the ventilation is adequate. When giving 2 initial ventilations to a drowning victim who is not breathing as part of the rapid assessment, pause between the ventilations to allow the victim's chest to fall. Remember, each of these ventilations should make the victim's chest begin to rise. If either ventilation fails to make the chest clearly rise, reopen the airway, make a seal, and try another ventilation, like this. When an adult is in respiratory arrest, not breathing but has a pulse, or respiratory failure, ineffective ventilation, but has a pulse, give ventilations at a rate of 1 ventilation every 6 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. For a child or infant in respiratory arrest or respiratory failure, give ventilations at a rate of 1 ventilation every 2 to 3 seconds. 1, 1,000, 2, 1,000, 1, 1,000, 2, 1,000. Give ventilations for about 2 minutes and then check for breathing and a pulse. If the person is still not breathing but has a pulse, continue giving ventilations for another 2 minutes and then check again for breathing and a pulse. If at any time the person does not have a pulse, begin CPR immediately. When a person is in cardiac arrest, not breathing, and no pulse, give 2 ventilations after each set of compressions. Pause between the ventilations to allow the person's chest to fall. If the chest does not begin to rise on the first ventilation, reopen the airway and give a second ventilation. If the chest does not begin to rise after reopening the airway and giving a second ventilation, an object might be blocking the airway. That is, the person may be in cardiac arrest due to choking. You will learn about caring for an unresponsive person who is choking later in the course.